Hello guys, welcome to our channel. Our group members are Sun Xuanyang, HAOYU, Qing, and YIRAN. Our topic is global health and immigrants. More specifically, we'd like to talk about the analysis of the impact of refugees on global health. Let's start with a short introduction. About global health, global health refers to health issues and the health promotion actions that transcend national boundaries and encompass a wide range of factors that affect human health on a global scale. It is not only concerned with the prevention, treatment, and the control of disease, but also encompasses a wide range of aspects such as health equity, the distribution of health care resources, and the impact of social and environmental factors on health. Global health is currently facing multiple challenges. First, communicable diseases remain one of the major threats to global health. For example, the COVID-19 and AIDS have a severe impact on the global health. Second, non-communicable diseases such as diabetes and cancers have become a major cause of high mortality in many low and middle-income countries. The impact of environmental factors on global health is also increasing with climate change and environmental pollution. Then, in terms of the immigrants, there are people who move from one country to another for various reasons. Immigrants can be classified into various categories, depending on the reason, purpose, and the legal status of the movement, including working immigrants, refugees, asylum seekers, international students, and family reunification. Among the many immigrant groups, the impact of refugees on global health is a hotly debate topic in society, and it also aroused the interest of our group to exploit. Refugees are individually or groups of people who have been forced to leave their country and seek asylum because of war, conflict, persecution, or violence. According to the United Nations High Commissioner for Refugees, as of 2022, there were 108.4 million people worldwide who have been forcibly displaced due to conflict, violence, or human rights violations. This includes over 35.3 million refugees specifically. About top refugee hosting countries, the countries that hosted the most refugees are typically neighboring those in conflict. Turkey hosts over 3.6 million refugees. Iran is in second place, who hosts 3.4 million refugees. About top countries of origin for refugees, the country generating the most refugees include Syria, Ukraine, and Afghanistan. Meanwhile, nearly 50% of refugees are children under the age of 18. Women and girls make up approximately 50% of the refugee population. Next, my group members will specifically analyze the impact of refugees on global health.
Thank you, and let me introduce the impact of refugees on global health. Next, please. So refugees encounter many health problems for their own reasons, and during their role, there are some problems. First, poorly controlled chronic conditions. Second, mental health and specialty support. Third, maternity care. And fourth, untreated communicable diseases. Next, please. So a few of the most important issues are the following. That is, refugees face significant health challenges, including life-threatening pregnancy, complications, rising pregnancy, chronic illnesses, and high-risk several mental health issues such as PSD and depression. Next, please. So the reasons why refugees get diseases can be divided into three parts: before, during, and after the journey. Before the journey, refugees may have some illnesses due to their own reasons, and they may not be able to receive timely and effective medical treatment due to the limited level of medical care in their own countries. And war or persecution always break out suddenly, so that the refugees do not have time to prepare for it and forced to embark on the journey. During the road, refugees may live in or pass through vulnerable spaces, including along transport roads, urban slums, and construction sites. These spaces may contain social, economic, and physical conditions that may increase exposure to disease. Upon arrival at the destination, different policies have different impacts on refugees. Some high-income countries, for example, take very strict measures to manage their borders, specifically between January 1993 and June 2015. Policy and border control measures across Europe result in 2,200 deaths, language and cultural differences are also important issues. Refugees find it difficult to communicate with locals, and it's difficult for them to get the necessary medical help. At the same time, for policy reasons, the length of the stay of refugees is increased, resulting in a prolonged period of time during which they do not receive medical assistance. So that's the place. Refugees' health problems have a significant impact not only on themselves, but also on the host nations. Next, please. Firstly, the difficulty of providing medical services as a large number of refugees and different languages and culture makes it difficult for existing medical faculties in a country to provide good medical service for all. Education, training, and orientation in health services require time and commitment. Second one is the size of migrant population and the diversity with migrant communicates with population, and population can mask significantly different groups with disease vulnerabilities. Health practices may differ significantly by group, particularly in the health promotion strategies and approaches to disease screening between source and host nations. Last one is the large number of refugees and the actual problem of disease have placed a huge burden on national and world health systems. But the need to control the spread of number of infectious disease requires adequate funding. But prolonged medical assistance has overwhelmed the financial situation of a number of organizations. That's on my part. I will pass my partner. Thank you.
In my part, I will introduce the impact of refugee integration on the health system in Uganda. Next page, please. Uganda is heavily impacted by potential instability in neighboring countries. It has become a major destination for refugees, hosting around 1.6 million people. Among them, 57% are from South Sudan and 32% are from Democratic Republic of Congo. The Ugandan government provides refugees with the same healthcare, water, and education services as the residents. However, these efforts have placed great pressure on Uganda's health system. Next page, please. First one is public health changes. The arrival of refugees increases the risk of cross-border disease transmission. In 2018, Ebola cases from the Democratic Republic of Congo were reported in Uganda. Refugees from South Sudan has also contributed to the spread of diseases like HIV and so on. Poor living conditions such as overcrowded shelters worsen respiratory disease outbreaks. These changes have added significant strain to Uganda's public health system. The second one is the shortage of medical resources. Although refugees have access to basic healthcare services, Uganda struggles with shortages of essential medicines and supplies. Cuts in funding from the United Nations High Commissioner for Refugees have made the situation worse. Many healthcare facilities are understocked, forcing refugees to pay out of pocket from medicine. This undermines the fairness and accessibility of medical resources. Third one is funding changes. Uganda's health budget is much lower than the 15 targets recommended by the Abuja Declaration. This makes it difficult to meet the complex health needs of refugees. International donations provide some support, but are often tied to specific projects. The lack of flexibility limits Uganda's ability to handle emergencies and improve its overall healthcare system. The last one is shortages of healthcare workers. The refugee influx has worsened Uganda's shortage of medical staff. Humanitarian organizations have filled some gaps, but only half of the approved healthcare positions are staffed. Financial constraints also prevent hiring more professionals. The shortage of mental health specialists is a serious issue. This leaves the growing psychological needs of refugees unmet, reducing the quality of care. Next page, please. So the arrival of a large number of refugees have created serious changes for Uganda's health system, including higher disease risks, insufficient medical resources, funding, and staff. To address these issues, Uganda needs to strengthen international cooperation. It must also improve resource management and expand healthcare capacity. These steps will help ensure that both refugees and local residents receive adequate care. Thank you.
Now I will introduce policies on the health of refugees and migrants. Good health is an essential requirement for refugees to be able to rebuild their lives. Yet decades of forced displacement can take a significant toll on an individual's health and well-being. UNHCR's public health programming supports refugees so they can be as healthy as possible. UNHCR works with governments and partners to provide emergency health services, improve local health services, and include refugees in national health system and plans. So how does UNHCR help improve the health and well-being of refugees? They strive to improve the health and well-being of refugees by addressing the full spectrum of their needs. They begin by approaching public health from multiple angles, including advocacy for inclusion into health policies and systems, increased access to health care, nutrition, water, sanitation, and hygiene services, promotion of healthy living, and collection and analysis of health data. Next page, please. UNHCR emphasizes a comprehensive health approach, which includes the following 6 core areas: access to healthy care, mental health and psychosocial support, sexual and reproductive health and HIV, nutrition and food security, water, sanitation and hygiene, strategic health information. Next page. Furthermore, the first Global Action Plan on Refugee and Migrant Health, adopted by WHO member states in 2019, highlights health as a key part of refugee support and migration governance. The main priorities of the Global Action Plan are as follows. The plan aims to improve global health equity by addressing the physical and mental well-being of refugees and migrants while supporting the Sustainable Development Goals and the objectives of the Global Compact on Migration and Refugees. Next page, please. In conclusion, addressing the health challenges of refugees and migrants is critical for global health equity. Initiatives like WHO's Global Action Plan and UNHCR's public health strategies aim to improve access to health care, promote well-being, and integrate refugees into national health system. However, the challenges are evident. Uganda, which hosts around 1.6 million refugees, struggles with overcrowded shelters, limited medical supplies, and funding shortages, putting immense pressure on its healthcare system. It emphasizes the need for stronger international cooperation, increased funding, and inclusive policies. Only through collective action can we address these challenges and ensure better health outcomes for refugees, host nations, and the global community. That's all. Thank you for your listening.